Together we achieve victory over heart failure.
Hello, welcome to the podcast. I am Dr. Arvind Kaul. I am Director Cardiology at Paras Hospital, Panchkula. Today we'll be talking about heart failure. Heart failure is a sort of achieving epidemic proportions in India with aging population, and surprisingly in India there are a significant chunk of patients who are very young. It is normally supposed to be a disease of old, but in India there's a significant chunk of patients who are young. First of all, what is heart failure? What does it mean? It seems to be a terrifying term and seems to be something like end of life thing, but it actually is not. Heart failure means that heart has become weak. What does that mean? That means that it cannot pump sufficient blood as per the requirements of the body. Normally, heart has only one function, that is pumping the blood into whole of the body. And if it is not able to do that work to the requirement of the body, that is called heart failure. So if a doctor tells you heart failure, that doesn't mean that something, it is a dangerous disease, of course, but it is not something you have to be really as it is end of your life. Heart failure, basically diagnosis you can do is by various tests. Most commonly what we do is an echo and we see what is called the ejection fraction of heart. Ejection fraction means how much does the heart pump, how much blood does it pump. Normally it should be in excess of 50%. Normally it is around 50 to 70%. Anything less than 50% can cause heart failure, and lesser the value, more severe are likely to be the symptoms of heart failure. What are the symptoms? Symptoms are most commonly is breathlessness on exertion. If you do minimal exertion, you get breathless, symptoms are more severe. Some patients get what is called orthopnea. That means once you are upright, you are comfortable. The moment you lie down, you feel breathless or you start coughing. That is also a feature of heart failure. Then there can be what you call fatigability. Because body is not getting adequate blood, tissues are not getting adequate blood, you tend to fatigue very easily. And there are other features like palpitations. You can get swelling all over body, particularly in lower limbs. So in addition, you can get some other loss of consciousness and episodes or heart failure or palpitations. So what can you do? Basically, first thing is, what about prevention? Prevention is basically like any risk factors for the heart. You have to look for them and get them treated. Diabetes, hypertension, high cholesterol, these are very common things. These will lead to heart problems, which ultimately cause heart failure. Heart failure can be a result of many things. Any heart disease can ultimately lead to heart failure. So whenever you get regular checks, early diagnosis of disease, early treatment, and that goes on in long term to prevent heart failure progressing in severity. In addition, good lifestyle, regular exercise, avoiding stress, avoiding alcohol, tobacco, all these things help in prevention of heart failure. And what about treatment? Treatment is there. There are lots of medications which prolong survival, that they make you live a healthier life, almost a normal life. There are certain devices which you can put into the heart and which prevent complications of heart failure from happening. Ultimately, if there is no response to treatment or after treatment failures, there are artificial hearts, there is cardiac heart transplantation. So there is a number of options, but the basic premise is regular checkups, getting diagnosis of disease early, and getting treated for that. The lifetime risk of heart failure is about 1 in 5. That means 1 person in 5 persons can have heart failure at some time in their life. So it is a very prevalent disease. So what is important, that you take regular preventive steps so that you don't have to face such a disease. Thank you.